Hi, all. We're coming to you live from our webinar. Bevan and I are not together, as you can see. It's been very sad.
Although I am in your apartment.
She is, yes. We've been apart for about 2.5 weeks now, I think.
Mm-hmm.
Just kind of crazy. But we have been listening to a lot of what you guys have been asking us, a lot of your concerns. And we could not think of a better person to have on with us today than Dr. Boas. She is the Assistant Professor of Medicine at NYU School of Medicine. And on a personal note, a very, very close family friend of mine. You're like my sister, right? So we've known each other basically our whole lives. And I could not be more, it just fills me up with emotion because what you're doing right now and how you're serving others and helping others, it's just amazing. We could not commend you more. So we're so honored to have you join us and be with us today.
Well, thank you so much, guys. Bevan, Britt, thanks for having me. I'm a huge fan of your podcast. So I know a lot of people are at home right now. They have a lot of questions. And it's really, we're in unprecedented times. So I'm really happy to be here so I can, answer some questions for your audience.
Thank you so much.
Definitely.
You're a real life hero.
Yes, we're just in awe of you, honestly, in all that you do. So the first thing that actually we had and that a lot of our listeners wanted to know is, honestly, how are you doing? Mm-hmm. And describe for us the past month in your eyes.
Mm-hmm. Well, that's a great question to start with. A lot of people who don't work in the hospitals, who, aren't familiar with healthcare, they're seeing kind of a very different side of this, right? So, from a doctor's perspective, this is like unprecedented what we're seeing right now. You're walking on the street, you're outside, there's no one there, right? Everyone's gone, all the stores are closed, the parks are closed. There are very, very few people. You walk into the hospital, it kind of like looks like the videos you're seeing in China with people like checking your temperature, a temperature gun, you go in, and basically it's a zone, a war with people. Everyone is kind of working together to help patients and kind of like to really fight this virus and to get all together. It's like anything I've ever seen before. I work in internal medicine, so there's like emergency room, internal medicine, ICU doctors. You've heard kind of a lot that these are people in the front lines, but really people from all different specialties, all over the hospital, really coming together to work together. People from like orthopedic surgery are working as interns, and nurses from all over, and physician's assistants coming from all over the country, really to help us. So, that sense of community that I've seen in the hospital it's really amazing.
That's a nice little, thing to hear in the midst of all this, is like that the humanity is something that we can really see. It's in our forefront right now, which is incredible. So you mentioned earlier when you spoke with Britt that you've been getting a lot of texts and a lot of calls from patients with symptoms that are likely indicative of coronavirus. Can you describe to us what those symptoms are and what you've been actually seeing?
Sure. Yeah, so it's kind of I go to work all day. I'm talking to my patients, and I get a lot of like messages. We have like the online portal. We get a lot of messages from our patients, but then I like look at my phone, and it's like they're just like on and on in text message, and I love it, but at the same time, it's tough. But
it's a lot.
It's a lot. But the symptoms that, again, you've probably seen this, you've heard of this. There's like a variety of symptoms, but the most common symptoms that we see are a fever, which can include like a low-grade fever, cough, shortness of breath, and a sore throat is one of the main ones that we added to like our screening criteria a few weeks ago. But I've seen a lot of people who complain of headaches, who complain of a runny or stuffy nose. And other people, most people have also the symptoms of like body aches, myalgias, similar to like the normal flu. And then some stomach symptoms some people have. It's not as common, but like GI upset.
Wow.
So I heard from someone that someone that has it, she was feeling better like day 3, 4, and then came around to day 7, 8, 9, and it started to get really bad again. And it was the breathing that got worse. It was the scariest part for her. And she said this is common, that they're like halfway through, you can feel this sort of resurgence of breath shortness.
Yeah, that actually happens very commonly. It's people, they call, like a lot of my patients will call on like day 1 or 2, and people are obviously know what most of the symptoms are, and they say, hey, I have a fever and a cough or whatnot, and then most people are getting like the precautions from the doctor, stay home, just supportive care, etc. But then there is this time, sometimes it's happening like 7 to 10 days, 7 to 11 days after they first get like a mild illness, that people are getting really sick. Like your friend, hopefully some people, this shortness of breath is what we're kind of worried about, right? People describe shortness of breath differently. Some people will say like they feel like a heaviness in their chest when they're coughing. Some people will say, I felt like I just ran a marathon. And when people have that shortness of breath sensation that they can't walk without feeling winded, you're concerned that they obviously probably have coronavirus, but now they're progressing and that it could be something more serious, that they might need like medical attention.
What's the moment that you feel like people need, that they should go to the hospital?
Yeah. So no one should just like show up in the emergency room, right? Like if you're feeling unwell, unless you have like a real emergency, right? If you like are walking and you feel like you broke your leg and you need to call 911, then the ambulance will bring you to the emergency room. But it's pretty unsafe to just like walk into an emergency room right now, especially because there's a lot of sick people there. You're putting yourself at risk, you're putting the staff at risk, et cetera. So the best thing to do is to call either your doctor if you have a doctor, right? But a lot of people in New York don't have primary care doctors. So that's like the honest answer. But there's also like hotlines in New York City that people can call, and I can give you them, but you can call 311, or you can call it's a 1-844 NYC for NYC. So 1-844 NYC for NYC. And there'll be like a live clinician that will call you back within like, 5 to 10 minutes. And they really help triage a lot of these cases. So they'll see what your symptoms are. They'll ask you if you have any other medical problems, because we know people who have like underlying medical problems, like poorly controlled diabetes, they're immunosuppressed, any type of like organ damage, that they're at higher risk for complications. So they will evaluate you and talk to you and decide if you need to go to the emergency room. But in terms of the symptoms that are concerning is again that shortness of breath, and also if people can't like eat and drink anymore, if they can't take care of themselves at home, they should definitely go in. Yeah.
Okay. And is there a moment, if you had coronavirus, is there a moment that you're not contagious? Like when does it end?
Yes.
So again, that's a great question. And I think people are really, especially in our area, are really trying to figure that answer out, because, if you're sick, like when can you go back to work? When can you do other things? And the guidelines right now are saying that basically you need to stay out of work for 7 days after the onset of symptoms, at least 7 days. And the last 3 days of those 7 days, you can't have a fever at all, so you can't take Tylenol, and so no fever, and your symptoms have to be much better. So if you have like a cough or shortness of breath, things like that. We'll recommend that's mostly for healthcare workers. But I think a lot of people, again, the answer is we don't know. So I think it's safer to say maybe 14 days. If you're feeling better than 14 days, you should really stay in your house and only go out for like really essential things, like go to a doctor's appointment, or like if you can't go grocery shop, if you can't have someone else go grocery shopping, they can do that for you. But there's reports that people have like what they call like this shedding for like maybe a month, but we don't really know, I guess, is the answer.
Right.
Yeah.
So I guess for those people and for your recommendations to getting back on the mend, other than, the quarantining for 14 days and depending, of course, on what symptoms they have, is there anything else that you recommend to do? Is it, we've heard people or listeners were asking us about tapping firmly on the back, if that's a wives' tale, gargling with salt water, that helps with your sore throat. We didn't know if you had any insight towards some of these things that are coming up.
Right. So I love that people are coming up with creative solutions. The tapping on the back is like an interesting one. I mean, if maybe you might have heard about when people are super sick, we flip them on their stomach to help the aeration in their lungs. So I don't think there's any evidence for the tapping on their back, but
okay.
I don't know. But but I've heard other people have sent me ones. I'm not going to say who, but gargle with salt water every 2 hours and this and that. But there's no evidence for most. I think the real evidence, as you guys know, coronavirus is it's in the same family. A coronavirus is one of the common colds, right? So there's so many different viruses that cause common cold, and this one is a novel one, right? So we've never seen this before. We don't have it. We don't know a lot about it. But we can. A lot of the inferences we can make is based on what we know about the common cold. So things like adequate sleep, adequate nutrition, stress management, the things that we recommend already for to keep yourself healthy are definitely things that we would recommend in the stressful time. So making sure you're getting at least 8 hours of sleep, that you're eating regular meals, that you're eating nutritious foods, and avoiding as much as you can drinking a ton of alcohol, things like that.
Right.
I mean,
it sounds normal, but you'd think, yeah. I knew some people who thought that they had it, but they were still drinking, and it's it's maybe put the wine away for those nights that you're not feeling the best and let your body rest. You know what I mean? But they're better now, which is good. But I think, yeah. So, but anything with ibuprofen or medicines to help curb temperatures?
Yeah. So that's some people have probably seen there's a little bit of not a controversy, but there's thoughts about how the virus actually infects cells, and that the receptor works in this kind of in the same similar mechanism as where ibuprofen works. So the thought is that you could potentially wouldn't. Anyways, the long story short is we're recommending more Tylenol than ibuprofen.
Okay, because it's supposed to it can make your symptoms worse, right?
Yeah, I don't think there's really any evidence, and
Okay.
I guess the answer is we don't know, and a lot of these things we don't know. So if people have the ability to take Tylenol works as an antipyretic, so it helps a lot more with the fever. An NSAID or ibuprofen won't help as much with the fever. So Tylenol is good for just said muscle aches and again fever.
What about Xanax? You said reduce anxiety. I'm kind of being serious.
Yeah, no, I've gotten, for people who are sick and people who are not sick, I mean, obviously this is just a really stressful time. Everything is different from what anyone's ever known. People are working from home. People are in close quarters. We're told we can't go outside. We're told we're very social beings, right? So the loneliness, the stress, the anxiety is very real. So, I mean, something like Xanax, is like a medication that temporarily, we kind of think of it as like a Band-Aid, right? So if people are having like panic symptoms or panic attacks, then, something like Xanax might be a temporary choice. But, there's a lot of things out there to help reduce people's anxiety, like different apps, like the Calm app or the Headspace or things like that people can do. Would definitely recommend like however much time, 10 to 30 minutes a day of just stillness, mindfulness. There's a lot of other options out there.
Right.
So you're saying don't resort to that.
It's a Band-Aid.
It's a Band-Aid for everything, right? So even like a lot of people will take like a Xanax or something like that if they're having trouble sleeping. But again, these are like times that we've never seen before. So Xanax is like an addictive substance. It's, it can cause a lot of problems.
We are not promoting the use of Xanax.
That's all I was saying. Everybody has their individual things.
But it's super important. So like, as you guys know, if like people are having like stress and anxiety, there's a lot of also support from like therapists and other people, like the community to reach out. Keeping social. A lot of people like doing like happy hour, or like, I don't know, meetups or Zooms.
Right.
But if you're not in that position, some people might not have like the ability to do that, especially like more vulnerable people or older adults. Maybe some of your viewers or listeners that, there are a lot of supports out there for people.
Sure. It's really good to know. Yeah. So is your hospital still conducting tests right now?
So yes. And the testing has changed a lot. Like every few days it's changing who we're testing. For maybe like a week or two ago, New York City made the decision that they were only going to test people who were hospitalized. And that decision was made in the setting of like what we call like sustained community spread. So in New York, it's like so many people are now infected that the thought was that, everyone, basically a lot of people have the virus. Most people coming in with symptoms have the virus. And there's also a shortage of testing. So they made the decision not to test like outpatients. But recently they've changed that decision. And now we're testing mostly healthcare workers who want to get tested.
Okay.
Yeah.
Got it. Because we have a lot of people asking, if I want to get a test, where do you recommend that I go? But now I know you said to call your physician and doctor first before that. And then because there's not necessarily those testing centers that are actively giving tests. Right.
For some people, like, for example, if you have like underlying medical conditions or you're at high risk for, your condition getting worse, then maybe they might test you. But for most people, it's like higher risk for yourself to go to one of those places, right? Like there's so many sick people around there. Even the healthcare workers are like around sick people. So if I were someone who had like mild symptoms, I like would want to stay very far away from any, like anywhere, like a health testing area anyways. I know people want an answer and they want to be like, I have coronavirus. Those tests might be coming in the future. For example, like a serology, like they're going to be able to maybe test if people have been exposed, and that might be coming in like a few months to test people. So
okay, good to know. Yeah, I thought you could just walk up to a place and maybe get a test. That. No, I definitely not. But that's what a lot of people were asking. Yeah. Let's go to isolating at home and some of the questions about your self-care. So what are your guidelines here? We have a lot of our listeners wondering, is it okay to walk or run outside, do a light workout? What are Dr. Boas's guidelines for quarantining yourself?
Great. So I think it depends, right? Well, actually, the first thing I'd like to say is that a lot of these like self-isolation guidelines are not really about you. They're about like protecting the community, right? Protecting your neighbors, protecting like the old people, protecting the young people, protecting like everyone. And it's not just about you. So kind of have to keep that in mind. if you're sick, like if you're actually sick and you're having any like mild symptoms, like you really should be staying at home and only going outside with like a mask on for like essential things. So you shouldn't be exercising outside. Well, I hope I don't know, people are crazy. So, but for that, if you're sick, you should really be staying in like your own area of your apartment if you can, wiping down common surfaces, things like that. But if you're not sick, right, if you're just, trying to be a responsible citizen at this time or a responsible person, basically like wiping down spaces that you use regularly, washing your hands, like that's the number one thing we recommend, right? Like washing your hands well for 30 seconds will kill this virus. This is just like any common, like anything without like 60% more alcohol or anything you have at home for regular cleaning will kill this virus. It's not, I don't even know what kind of, like, it's not like a very hard, it's just a regular virus. So again, so for example, like I went running this morning. I go running a lot. It's something like I like to do. And it's hard, right? So like going outside is like good for your mental health. But like in New York, the paths are small. It's hard to stay 6 feet away from people, but really you have to do your best to do that. When you go outside, I also would strongly recommend like not touching anything. So not like sitting on a bench, not touching like, I don't know what.
Common
areas, like just because like that's where virus can live.
Got it.
So
do you run with a mask?
So that's a good question. I don't. I saw a lot of people wearing masks this morning. So I guess we can go into because I know a lot of people have mask questions.
Tons of masks.
So
There's so many conflicting messages about these masks, and all of our listeners were like, what do we wear one all the time? What do we do? All my girlfriends are like, do you have your masks? Have you made your masks? I just am nervous, I guess, to wear a mask. I don't know. I don't know.
I ran with a balaclava on the other day. So it's one of those things you put under helmets and only my eyes were out, but I could still breathe. I'm like, but I'm wondering though, is that protecting me from spreading it if I do have it? Yeah. If I have air.
Yeah.
Coming in and out.
So the idea of masks, right? So just talk a little bit how they work. So most of the masks that are not like the medical grade ones or just like any type of like fabric mask or like even the regular surgical mask that we have in the hospital, not the N95s, just a regular mask. It prevents you from infecting other people, like you said, Bevan. So if you were to sneeze or cough, it would protect the people around you. It's not protecting yourself from anything.
Okay.
It's just protecting other people. So actually yesterday, the CDC put out new guidelines that they recommended everyone wearing a mask, a non-medical mask in public areas. So, and there's a lot of controversy, right? Because like World Health Organization is against it. So there's not really a right answer right now. The medical grade mask, like the N95 is the one that like, the ones that some of them look like a gas mask and that is not like people should not be wearing those in public. That does prevent like theoretically from you getting infected, but like we should reserve those for like medical professionals and health because we obviously have a shortage of those. But the recommendation is to like make your own like DIY bandana or whatever you want to do. So that is what the recommendation is right now. If in theory, if there's a fair amount of which there is like what they call asymptomatic spread, so people who don't have symptoms, if everyone wore a mask, like I guess in theory, this could reduce the spread.
Okay.
Yeah.
So you do, so you do recommend now putting one on to go to the grocery store or that's where I've gone a couple of times to the grocery store and to Starbucks.
I would say if you're going to be in a public place, if you have to be in a public place where you cannot self-isolate for more than 6 feet, then you should wear a mask. Like in New York City streets would be a good place. If you're in
Okay.
Connecticut or you're in the suburbs somewhere where like the closest person's 20 feet away, then you don't but still the masks aren't like, you still have to be like observing like really great hand hygiene, all the other things that we're talking about. This is not instead of that. This is in addition to that.
Got it.
Yeah.
And as far as the like homemade masks go, are there any requirements that we need to, I mean, can we just use a scarf? Can we just use the liner of your bathing suit?
I think the recommendations are that it's just something that will like cover your face. So I think even like a bandana, but I think there's a lot of like tutorial, like people like making their own, you know, again, I went running today. I didn't wear a mask. I like was super trying to stay away from people. I like pause at a certain place. You know, if there's someone on the sidewalk, I'll like go in the street, like do all these things. Then like wash my hand, like come right in from my apartment. I'll like wash my hands, take my shoes off, take a shower right away. So yeah.
Okay. So another question is, we had a lot of listeners that were asking about visiting their older parents. Someone wrote in and asked if her mom and her have been quarantined for 19 days, can they get together at one of their apartments?
Yeah.
What would you guys say? What would you say?
I mean, I would say no, because I don't believe you can fully quarantine for 19 days without going to get any sort of food or receiving a package or.
Yeah.
I mean, I still think you'd have to, if you're going to be in the same place, that you'd have to self-quarantine yourself for 14 days. I don't know. I feel for some of my friends, and a lot of them missing their parents. So, but I don't know what the right answer is.
So what I would say is, again, everyone's situation is very different, right? So some people don't have some people are like living with older family members. They don't have like the like people are, again, have all different like social situations. But I would say, there's a lot of factors that go into play. Like, where did the people live? Like, do they have to go into an apartment building? They have to touch buttons. As you said, Bevan, people are getting like delivery and going to the grocery store. So if you think about each person or each family as like a family unit, every time that something comes in, it's like, say that, for example, Brittany goes to the grocery store and she sees some other person who like has been exposed to all the other people, and then she goes and she sees like a friend that's like 6 feet away, and then she comes home. So all these things are being exposed to her entire family unit, like all the people at home, and that's kind of where the risk happens. So especially older adults, like we're saying anyone over the age of 50 is at increased risk of getting sick. So I know it's super hard, right? And like we miss our families, we miss our parents. But I would say, unless you really have to, unless your parents need your help for like, you know, showering and making food and things like that, that I would probably keep your space right now.
Bevan, you're going to go down to North Carolina, and you said yourself, maybe if you do happen to move, but you said yourself that you would first quarantine yourself for 14 days.
Right.
Before.
And then I would still only see my parents at least minimum of 6 feet away. I'm not going into their house.
Not going into their home.
I'm not. I can't risk that.
Right.
Yeah.
Smart.
So and that's going to be really difficult, you know, to see my parents for the first time in a long time and not be able to hug them, to grab them. And like, it just is what it is. But if at least I can be, you know, near them in a way that like I could see their face and wave, and we could just have a really long table at dinner. Will and I on one side, her and Dad on the other. So,
sorry, I interrupted you. What were you going to say?
Me?
Or you were asking another question, I thought, but B?
I don't remember.
Oh, okay.
We lost it.
All right. Well, that really does help us though with about visiting family members and for all those people that want to travel to their families and get away from where they are right now. But kind of moving into that, we know a lot of listeners that are moms, a lot of new moms, and just really concerned for their babies and their infants, and wasn't sure, if you had been seeing increasing cases in infants, if it was okay to be breastfeeding your newborns, taking them to their doctor's appointments, kind of what you had been seeing on those cases.
Mm-hmm. So again, that's a really great question. So I mostly do adult medicine, but I have a lot of like friends, and this is like a really big topic of discussion right now. So two of my friends who are actually doctors in New York City, they have like infants, like 3 months or less. And they actually, a lot of doctors in New York, like my friends have been like sending their families like away, like out of New York City to like the suburbs, other places, because they're worried about like their kids and their spouses being infected because they're like high risk, which is really like selfless and scary situation, right? But they're both breastfeeding, and again, we have to think of this as a respiratory illness. So if you're just washing your hands, if you do have symptoms, wearing a mask would be like recommended during breastfeeding, but otherwise there's no reason not to be able to breastfeed. There was like I looked up a study from like China, a small study, I don't know, 30 patients or so. They looked at mothers who were infected, and there wasn't any evidence. There was what we call like a vertical, like you can't give it to your kid by like having a child if you're pregnant, or so that the studies showed that, and most of the kids, like young kids who got infected, a lot of them mostly have mild disease. We aren't really seeing like this is not quite like the flu, but again, what we're seeing in the U.S. is different than what they're seeing in China a little. There are younger people that are getting sick, but overall, again, this is not like a disease that should impact infants, et cetera, as much. In terms of going to their like well visits and their pediatrician visits, highly recommended that people still go to those visits. It's really important for young people, young kids, to get their vaccines against preventable diseases. For example, like measles, mumps, rubella, all those things that are way more infectious than coronavirus. And you definitely want your kid to be like, have those vaccines in this time.
Okay.
But again, if you're sick, or even if you're high risk, like one of my friends his family's in New Jersey, the pediatrician asked because she works as OBGYN in a big New York hospital and she's still working, they just asked maybe if she wouldn't come to the visit because they didn't want to expose the other people in her practice for her to come, which she wasn't thrilled about that.
Yeah.
But
I can't imagine.
So
I can imagine. So Brittany and I have opposing views on this next question, and I'm very curious to hear what you have to say.
Yeah.
What do you think about food delivery?
So I guess do you want me to ask you guys what you think? Or should I just?
I have cooked every single meal at home for the past 4 weeks.
We have not. We are supporting our small businesses, and we've cooked a ton. We made taco night the other night.
Sound like a dick. I'm supporting my businesses too.
I know that. I know that. I don't know. The Levines, we're very optimistic people. We're very calm people. I've been wiping down surfaces forever. Like traveling with me, I'm like the germ person. Like I wipe down everything. I wipe down my car. My husband is like a Lysol ambassador. Like he literally cleans everything like 5 times. So we just are very calm about everything. So we've been ordering delivery, and we've been going to do curbside pickup and not touching or exchanging. We have gloves on. We're not touching hands with anyone, and we wipe our car down after we get out of the car. I don't know. That's just us.
So again, for this one, there's not really a right answer, right? You can think of it.
I really want you to say I'm right.
Okay, you're right. Okay, so you can think of it as like a personal, like the person who's either getting the food, right? So we think about us, like I order delivery or if I get a package or if I get curbside delivery, you can think about your personal risk. But I think some of what we need to think about is like the risk to other people, right? So the risk of the delivery driver, the risk of the person cooking the food, right? So if let's start with the person, like let's think about how we could get infected from delivery food. Okay. So it would have to be like a series of perfect events that would happen. So for example, the person in the making your food would have to like literally like, so say that they have the package, they sneeze on it or they cough and then they put their hand on it, right? They package it up, they give it to the delivery guy drops it off at your house, right? You would have to pick up the delivery, open it, touch your hand or whatever on the exact spot that the person coughed or sneezed, then touch your face, right? So all those things would have to happen for you in theory to get infected.
But you can't get it from eating the food.
No, you can't. There's no evidence right now that you can get it from, that's what the thought is, that you can't get it from eating, but there's like strong recommendations if you're going, the person-to-person interaction is like the highest risk. So for example, if you get the bag, as Britt said, when you get the bags, like wipe it down. There's like, some people are like advocating for like a clean and dirty area, right? So the dirty area, you get the bags, you wipe everything down, you take everything out of plastic. There's thought that the virus could live on plastic for up to 3 days, also like cans, and that even like cardboard boxes, 24 hours. So it's important, like hand hygiene is very difficult. Like you don't have to wear gloves, but you have to wash your hands thoroughly before and after you do this.
Right.
And like take your stuff out of the containers, throw everything out. So like if you do that, I would say overall, like you're probably safe yourself, but there is a lot of risk for the other people involved in this process, right? So is the delivery guy safe? Like going to all these different restaurants, like yes, there's like social distancing, but like not really. And like restaurants, is he like walking into apartment buildings, like opening the doors and like, do they have a lot of exposures? Yes, maybe. And the people in the kitchen, like a lot of kitchens are not set up so people can have social distancing. So,
Right.
You know, it's like if we're looking to protect our communities, I would say you can order like deliveries and food in a very responsible way. Also, for example, in my building, people are like going crazy with the ordering of the packages. So the guy in like the package room is like exploding. And it's like you have these poor people and the doorman and stuff is like trying to like, they can't really wipe down every package and they have to keep opening the doors and there's like overflow. And so you have to be mindful of the other people that are involved.
Are you wiping down your packages that you receive if you are getting anything?
So we're wiping things down. We're like trying to open it up right away and take things out.
Okay.
We're really cooking, like we're cooking all of our food. We're getting grocery delivery. The supermarket, I would say that's like my sister, like last week, I think she was like planning to go to the supermarket and I like intercepted her right before she went. And I said, please don't go.
Well, we've been going to supermarkets a lot.
So, but that's like, it depends, right? In different neighborhoods, there's different amount of people there, but
Sure.
And different supermarkets have different rules, but that's like a lot of people there. There's a lot of touch points where you could be exposed to something. So if people, again, like I have the luxury where we're able to like order food, but in some areas you can't do that. So,
Okay.
yeah.
No, that's good advice.
Okay.
Yeah. So have you decided whether you're going to order delivery now?
I mean, we go to the grocery store once a week, right?
Yeah.
We've been going, this is going to sound very obnoxious, but we have an Eataly around the corner. So we've been going to Eataly and oddly, there's not a lot of people there because most of the food there requires all prep, right? There's not like a lot of chips and things like that. It's just vegetables and fish and meat.
Right.
So we go in and we get as much as we can for a week, and then we do food delivery like every other.
Yeah.
Like not food delivery, like grocery delivery.
What about wine delivery?
I did one big order over 2.5 weeks ago, and every bottle that comes in, we completely disinfect and we place it in a special spot for a few days.
Okay. I hadn't asked you about that, so I was just wondering.
Yeah, I mean, it's time for another wine delivery. I've blown through that faster than I could have ever imagined.
Oh my God. Okay.
Oh, okay. So, Brittany, why don't you ask your question for me?
Okay. Well, no, this actually happened to be a lot of people, but this also is in my relationship too. So for those of us stuck with our significant others, or I do know a a few people, no, like 2 people that had been seeing someone and they really were craving intimacy. My husband's been freaking out about this, but is it okay to still kiss your partner?
So if your like partner is like in your household, right? So if you're not like going other places, then yes, it's completely fine.
Okay.
Like if you're like staying with them and home, you're not exposing yourself to other people like at work or other
Right.
reasons, then that's completely fine. But like for example, my friends or me who goes to work and I'm like taking care of people who have coronavirus and then coming home, like it's probably not a good idea to be like intimate with your significant other, or if you're like a delivery person, like again, or who work in a grocery store, you're like at higher risk. So that makes it really tough.
We say stay away.
I would say at least stay away for like my friends, or again, some of my doctor friends who want to visit their kids and want to like hug their kids, or like people are making up their own like quarantine. Like if I quarantine for 5 days and I don't have any symptoms, then can I like hug my kid? Again, people don't have the answer to that. But for people who are not like, who are staying at home, yes, there's no reason.
I will let him know that. Thank you.
Some of my friends, like one of my friends made a joke, and she had 2 of them actually have 2 kids, and they're like, no one who has any kids, like there will not be any like 2nd and 3rd kids born 9 months from now, because they're like at home with all the craziness going on. They're like, no one. No.
I think that was the funny thing that first started. People were like, oh, there's going to be so many COVIDians like born, or like whatever the phrase was, because of this quarantine. And now it's the opposite. People are like, back up, don't touch me. I don't know.
Maybe lots of first time babies though, right? Like people that are in space alone and passing time and
who knows?
Who knows? Who knows? So a couple questions about treatments. Are there any experimental treatments that you've heard are working? I've heard about this malaria drug.
Vitamin D.
Oh yeah.
Yes. So there are actually like a lot of clinical trials happening. A lot of them started in China, but now the U.S. is doing like, this is like a crazy time, unprecedented for research as well, because there's like everything. Usually things take forever in research, right? But because it's like such an like a crazy situation, that there's been a lot of like ability to start a lot of research projects. So the anti-malarial drug, the one you're referring to, which is also used, there's chloroquine, hydroxychloroquine. They're also used in like rheumatoid arthritis and like rheumatologic diseases and anti-malarial. So that's the first one that kind of got a lot of hype for obvious or not obvious reasons. But it came out of basically some small, what people are saying, anecdotal studies that were in China and France. So, you know, they were kind of just like observational studies. So it's almost like you look at people and you look at the results. So, but there is like a new study that came out, I think this week, that was looking at some people who took the patients who are not that sick. So they had mild disease, and there might be some evidence that helps like decrease the incidence of pneumonia in like a very small study. But that's people who are not that sick. So a lot of people who are coming into the hospital are getting that medication, getting the hydroxychloroquine. But it hasn't been studied in people who are really sick, and we don't have like that good of trials right now. But there's some promise for that. There's also promise. There's one drug called remdesivir, which was initially people developed it in response to Ebola, which was obviously a different type of virus. But the thought is people had studied it in like MERS and like the other SARS, which is very similar to this, like similar. So they're doing like big clinical trials. They have one at NYU. They're enrolling people in that trial right now, and that's for like sicker patients. But there is promise that one's also helpful. And there's one last one, which is an so it's an inflammation inhibitor called tocilizumab. People are calling like Tosi, like these crazy names, right? And they're doing big clinical trials for that one. And that's for like people who are sick. So people like who go to ICU or who are decompensating. But hopefully in the next like month or two, we'll have a better sense of which drugs are working. But they're really trying like everything. Like Britt was saying, like they're approving people to study a lot of things. But those are like the 3 main treatments that I've heard about.
Should we be taking vitamin D?
So I actually recommend for everyone to take vitamin D, like a low dose of vitamin D every day or every other day, like 1,000 units or.
I mean, it has to have D3 in it, right?
Yeah, so the D3 is fine unless someone's like super low. You know, we all don't have enough sunlight, so I recommend like a D supplement for like all my patients. Okay. It's very important to look at your supplement though, and just look at the ingredients to make sure. A lot of supplements have like crazy things in them, like cartilage and other things that you don't want to be eating. So making sure it's like a vegan supplement, doesn't have like I don't know, fingernails in it or something.
Wait, it's called? Gelatin.
Yeah. Gelatin.
Yeah, exactly. Like you want to just make sure whatever you're taking is very pure.
Is there a brand that you have that you like?
So there's a lot of different ones that you could probably get at like Whole Foods or G. There's not one specifically. Some people like the liquid vitamin D3, because you can just it tastes like nothing, and you can just put like a few drops in your like water or anything like that. But there's a lot of brands out there that make like vegan, like no additive. Like I think even like CVS has one of them.
Okay.
Yeah.
You're so good, Rebecca. You really, she's like, I will say this, but I cannot give you the
endorse.
I'm not going to endorse or.
Maybe I should make my own product, and then I can.
Yes, please.
I don't doubt that you will one day have that. I'm telling you. All right. So, and then I guess with a lot of our pet owners out there, people have just been asking about infecting their pets and having to walk their pets, and then if it's a dog, on their paws, wiping them off when they get home. Any insight or any truth to you infecting your pets or pets infecting you?
So again, that's like a very common question. People love their pets. I don't think right now there's not any evidence. Like I looked this up also. I don't really know the answer, but there's not any evidence that like pets like cats and dogs are like the vector for the disease. So there's not really any evidence that it can be spread from like a pet to humans, or we haven't really seen that yet. The thought is that if you're sick, like if you have symptoms, you should really like stay away from your pet, because in theory you could get your pet sick. I think like I don't think we know that you couldn't get your pet. So if you're like sneeze, but that's just like kind of common sense, right? If you're sneezing and you're coughing and you feel like shit, I guess you should like let someone else take care of your pet for a little bit, or give it to a family member, or not a family. I guess like just keep it in the other area if you have a partner. Not cuddle with your dog.
Sleep with your dog.
Yeah, sleep with your dog, all those things. But I think if you're healthy, then there's no reason. But the feet, like shoes and feet are like super dirty and disgusting without the coronavirus or with the coronavirus. So I definitely recommend wiping down your dog's paws, leaving your shoes outside, like all just the normal things we do, because we don't know if the virus can be on your shoes or your feet, but there's a lot of other viruses and gross stuff that can be. So
totally, we leave our shoes outside anyways, right?
Yeah. It's a no shoe.
No shoes here. Yeah.
I guess kind of starting to get towards the end of this, like, how does this ever end? Like staying in, like if we go back out again, won't there be another spike in cases and infected people? And the ones that haven't been exposed to it, the ones that were staying in. So like, it just feels very cyclical, and like there might not be an end in sight.
Mm-hmm. So that's a little bit of a pessimistic view, but hopefully, well, the lessons we've learned, like we have to rely on science here. We have to rely on people who know what they're talking about, and people who have studied. A lot of people have studied these kinds of things. There have been like epidemics, for example, like the Spanish flu or things like that. People like went out too early, and then yes, there could be like there's like a little the graph goes up, 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 and then it goes down. And then sometimes you see like a bump again. And that's from like the cases you're talking about. So people who are getting exposed late. The thought is like right now, the measures we're doing. So example, like social distancing, flattening the curve, crushing the curve, whatever, all these buzzwords now, are really just helping, at least in our area, helping like hospitals just like take a second and like be able to accept the influx of patients that are happening. So right now, a lot of patients that are coming in are sick, like really sick. So a lot of people are going straight to the ICUs. The ICUs are really taxed. We just basically, our hospitals are turning into places that take care of sick, like ICU and hospitalized patients for respiratory illness, which we're not used to doing. So the hope is that we can slow the number of people who are getting sick coming into the hospitals. Again, it's super scary right now, right? Like thousands of people are dying, hundreds of thousands of people are exposed. If that we can keep like the numbers keep going down, 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 and that we all like everyone does their part, right? That at a point, there'll be a fair amount of people who are immune from being sick already. Because the thought is that if you have this disease, we don't know how long the immunity will last, but there'll be a subset of people who are exposed and immune. And then there'll be a subset of people, hopefully, that we can vaccinate. And the vaccines take a while, right? If they're going to vaccinate billions of people, they don't want to like have a problem with the vaccine. So I don't know, they're thinking about like 8 months from now, maybe the fall they could have a vaccine. So I think that would probably be the numbers go low enough, we vaccinate enough people, and
falling apart over here.
Fall apart. But it's going to be at least like a few, like I would say what we're doing right now, like no one sees this like easing up for like a month or two more, like 2 months at least of like hardcore, like everything stays closed. And then we can reassess the situations. There might be places like New York City, which is like half the cases in like the US, and like that this area it's going to take a lot longer. And hopefully the concern is that if the numbers are so high here, that other areas, the other big cities, the numbers are going to pick up. So there's going to be an end to this. This is not going to go forever. Again, there's the concern, the biggest concern, like we're seeing in Italy, is that, and like my colleagues who are all doctors, is like getting to the point where you have to like ration healthcare, right? We never thought we would see this in my lifetime. I never thought that'd be like someone needs a ventilator or someone can be saved, and you're like, sorry, because we don't have the resources. So no one thought that would ever happen here. And that's where we're seeing that likely will happen. And that's really scary for like a lot of people. But there will be an end. And like, maybe things like, will people be able to go to concerts one day and sporting events? Yes, but we have to figure out like, if this coronavirus, like, could there be other viruses like this? How do we prevent, like, from a public health perspective, how do we prevent something from like this from happening again? And we really have to focus on that too.
So yes, that's a lot to take in, but I do agree. And I'm with you in saying that there will be an end to this. Mm-hmm. And that's where I think everyone, just going back to our first original question and everyone asking about you and your colleagues, in addition to staying home, how can we help you guys? How can we give back to you guys? Mm-hmm.
So I really appreciate that everyone's like thinking about all the people on the front line. So it's like, it's a lot of people, right? It's healthcare workers, doctors, nurses. It's the people in the hospital, like environmental services, who are like cleaning the floors and cleaning the bathrooms, and the security guards and delivery people and the people who work at grocery stores. And it's a lot of different people right now that are putting their lives at risk. So the number, and then at the same time, like, it's great. Like we're basically receiving like free food donations every day. Like it's really great. We love it. But at the same time, like we think about, and I work in like a safety net hospital, right? So I'm thinking about like all our most vulnerable patients who are like poor and, they can't afford food and they lost their jobs and all these things. So I think like there's so many organizations that are helping, like food banks, and like people can't even get like a meal to eat, and like homeless people and all that stuff. So I think if people like in their area, if they can like donate to those organizations, like that's really the people that are, like, everyone's hurting, of course, right? A lot of people, like, I'm not saying that, but the people who are most vulnerable, again, like, and like things like Meals on Wheels, people who, like, elderly people who can't leave their houses, who can't get groceries.
Right.
So that's where people can definitely donate if they're interested, or support people.
So selfless, so selfless in all that you do. Of course, that's what we're asking about you, and you direct it to other people that are in need.
Yeah.
So, I mean, honestly,
Takes a special person.
Really does. And so if we have other, people, I know you're inundated, Dr. Boas, but if we do have anyone else that is, a cause for concern, we're going to put this up. We're going to, we hope to address everything that you guys wrote into us. But if there are additional questions, we'll have that in a post, and you can totally jump on whenever you have the time, whenever you're not inundated. But we just can't honestly thank you enough for sitting down with us and just even talking to you, just because you are a source of such knowledge. I'm sure, Bevan, I know it doesn't take enough to calm me down, but you really have just such a calming presence, and you're just such a help. So I hope that we know that you've helped a lot of people in listening to this, and we truly, truly appreciate all that you're doing. And like I said, in awe of you, awe of you.
Thank you so much.
Thanks. And just to remind, like, things are always changing, right? So things that we know today can be different in like the coming weeks and months. So people are just obviously keeping updated, but at the same time, like, giving yourself enough space, like putting your electronics away, not watching the news, so like all night, so that people can really relax and focus. So thanks for having me on.
Dr. Boas, thank you so much. We really, really appreciate you.
Bye.
All right. See you soon.
Bye.
Bye.